Hello teachers and classmates, I hope that you are fine. My name is Monica Barahona and today my group and I will talk about the topic music during pregnancy, and also we will answer the question, does music affect the baby's brain? And before we begin, what kind of music do women should listen during pregnancy? Are you thinking in reggaeton, hip hop, rock maybe? And absolutely not. People recommended that women should listen lullabies or classical music during pregnancy because that kind of music helps the baby's brain, but we will explain more about that later. Now, first, as an introduction, what is a lullaby? Okay, now, a lullaby or cradle song is a soothing song or piece of music that is usually played for children, and the purposes of lullabies vary, and in some societies they are used to pass down the cultural knowledge or tradition. Also, lullabies are often used for the development of communication skills, indication of emotional intent, and maintenance of infants' undivided attention, modulation of infants' arousal, and also regulation of behavior. And one of the most important uses of lullabies is as a sleep aid for infants. And as a result, the music is often simple and repetitive. And now, where do lullabies come from? And in English, the word lullaby is thought to come from the lala or lulu, and they are songs made by mothers and nurses to calm children. And bye is another lulling song to or a term to say goodbye. A lullaby has a story to soothe babies and small children to sleep, and lullabies are found in every culture and sung in every language. Talking about music during pregnancy, the hypothesis that music has prenatal origins doesn't necessarily explain its survival value, but possibly some of its cross-cultural features comparable to rhythmic elements in the utero. There is a complete absence of cross-cultural studies on the effect of music on the fetus and infants, and in many cultures, lullabies have been sung for centuries to soothe babies, and thereby different elements might be effective, such as the pure effect of music, but also the combination of musical experience expressed by the mother's voice. The mother's voice has been proven to have an impact on the developing brain. And at birth, newborns react to musical rhythms of speech and thus orient to the social world. And it is even hypothesized that it is essentially musical because babies do not yet understand the meaning of words. And by listening to the mother, the fetus obviously stirs her musical speech features. So, we can say that the prenatal experience of music cannot be completely separated from that of the maternal voice. And now, what effect does music have on babies in the womb? And it is proven that music has a role in brain development before birth. And listening to music during pregnancy would not only have a soothing and uplifting effect on the pregnant woman, but also a positive influence on the unborn baby. And around 16 to 18 weeks of pregnancy, the little one hears its very first sound. By 24 weeks, the little ears start to develop rapidly, and babies have been shown to turn their heads to respond to voices and noise in the last few months of pregnancy. And an unborn baby can recognize her mother's voice, her native language, word patterns, and rhymes. And now we have a question. And listening to classical music will make the baby smarter? And the answer is that listening to classical music may soothe the baby and turn the baby into a classical fan later in life, but it will make the baby smarter. And this question has a relationship with the Mozart effect. And the Mozart effect was first reported in 1993 by scientists at the University of California. And people made a study and they found that college students who listened to a Mozart sonata for a few minutes before taking a test that measured spatial relationship skills did better than students who took the test after listening to another musician or another kind of music. And that means that classical music is good not only for babies but also for all people. The rhythm in music can help support the development of innate numeracy skills, and singing with babies supports their speech and language development. And listening to music and dancing with babies and toddlers supports sensory integration and motor skills. And this is all for me, and now my classmates will continue with the topic.
Hi teachers, I hope you are doing well. My name is Luis Armando Lopez Garcia and I am going to continue giving more details about this interesting topic named music during pregnancy. Does it affect the baby's brain? So as my classmate has already said, there are more benefits of playing music during pregnancy. It means that the babies who listened to music in the womb of her mother had more advantages and skills than other babies. So, in order to achieve these things, we have to take into account some aspects. For example, we need to know what kind of music should a pregnant mother listen to. So in the third trimester, the baby will be definitely able to listen what you play. But what kind of music can you play? So for example, you can play classical music and you can play some lullabies because all are designed to be soothing for the baby and is going to help the baby feel comfortable. Also, some European research in 2013 have shown that the babies who were exposed to music during pregnancy are more likely to suffer less illness than other babies. Also, studies have shown that the babies who are exposed to music during pregnancy are likely to remember a little part of the song. For example, the little part Twinkle Twinkle Little Star, and they respond different to another version of that kind of melody. Also, there are some tips for you to practice if you are going to have a baby and you want to play music. For example, you cannot play too much music because in that case the baby needs to feel comfortable and it not depends of the mother. It means that you don't have to listen to much music because of you. Instead, the baby needs listen to music. Also, don't play music aloud because that is going to be very dangerous for the baby because research have shown that playing slow music is better for the baby. And also don't forget to sing so the baby feel comfortable when the mother sing because the baby is going to feel the mother voice and that is going to help the baby feel very happy. So my classmate is going to continue and thanks for paying attention teachers.
Hi, my name is Evelyn, and I'm going to continue with our video. I'm going to answer two questions. The first one is, how does fetus respond to music? For this, we are going to analyze 2 points. The first one is fetal hearing. The fetus starts responding to music stimulation by the changes in the fetal heart and movement within 30 weeks of gestation. As the pregnancy advances, the hearing perception matures and the fetus responds to even low-level musical stimulations. Fetal heart rate increases on mother listening to rapid music and decreases on low and relaxing music. The second one is hearing development. Scientists have discovered that the structure of the ear is developed by 20 weeks of gestation. Although the fetus has been shown to respond to external sounds as early as 16 weeks, the hearing system becomes fully functional at 25 weeks. During this time, neurological connections between the brain and the cochlear system on the middle ear becomes complete. The second question is, how can music be beneficial during pregnancy? Music has been shown to help women in the following ways. Number 1. Studies have shown that music therapy can improve sleep quality. Number 2. Music can help lowering blood pressure in pregnant women with pregnancy-induced hypertension/preeclampsia. Therefore, can be an useful adjunct to the conventional preeclampsia treatment. Number 3. Music therapy can be beneficial improving prenatal anxiety. Number 4. Research suggests that the benefits of music interventions are effective in reducing anxiety during labor. Number 5. Music can help reducing anxiety, stress, and depression during pregnancy. Number 6. Studies have shown that listening to music prior the cesarean section provides better coping skills to deal with stress and anxiety before the surgical procedure. Number 7. It can help in reducing pain during labor. Number 8. Addressing good mental well-being is vital during pregnancy to prevent low mood and mental health problems after the childbirth. Studies have indicated that listening to music during the third trimester of pregnancy can reduce the risk of postnatal depression. This is all for us. Thanks for your attention. We hope you learned a lot from us. And remember, if you or your wife gets pregnant, listen to music.